Hello, class, and welcome back. For those of you that are new, my name is Ken Vitale. I am a sports medicine and rehab physician working here in orthopedics. I also teach anatomy and physiology at the university. And in this series, I expand upon some concepts that we go over in lecture and try to introduce a few extra different learning tips that we might not have covered, some occasional mnemonics, and hopefully some fun. Let's get started. And I love this quote. If you haven't come across it before, even if you have nothing to be grateful for, well, check your pulse. If you're alive and you're moving, well, that's a good thing. In this video, we don't have so much in terms of mnemonics, but a good learning tip is just imagining yourself as a small little red blood cell coursing through the heart, and you have to trace the pathway and therefore name all the anatomic structures that go through the heart. I made a little video here, and you can draw a lot better than I can, but we are going to start this video and trace the different pathways. Some of you right now, even before you start, you can pause the video and try to name all the different structures here, all the different valves, all the different chambers of the heart, and all the different great vessels. You can also draw in blue and red to signify deoxygenated and oxygenated blood. Let's get going here. Now, again, you can draw a lot better than I can. Sorry for my sloppy handwriting, but we have blue deoxygenated blood coming in through superior and inferior vena cava, goes into the right atrium through the tricuspid valve, through the right ventricle and out through the pulmonic or semilunar valve, goes out through the pulmonary trunk. We have a left and right going out to what? Well, the lungs, of course, again. Sorry for my goofy drawings of the lungs, but it gets the job done. Then it returns oxygenated blood now through the paired pulmonary veins, left and right. This drawing that I found on the internet didn't have it, so I had to actually draw in the right pulmonary veins here. Coming in the left atrium and goes through the mitral valve, circling back out through the left ventricle, through the aortic valve, and into the aorta. Fairly easy here, going through the aorta and down through the thoracic and then abdominal aorta, and we're basically done. Two interesting points to adult circulation are these structures. The fossa ovalis, it is the thinnest part between the right and left atrium, and then the ligamentum arteriosum, which used to be a structure when we were babies. Well, more accurately, when we were a fetus. Here we now have fetal circulation, and I'm going to pause it for just a moment here. There. Now we have drawn in the previously fossa ovalis, which is now an actual patent hole, the foramen ovale or ovale. It is a little hole or a little flap that separates the right ventricle here from, the right atrium here from the left atrium right there. And here the ligamentum arteriosum is actually a duct, is the ductus arteriosus right there, that then closes when we are born. Why do we have these shunts going through the atria and going between the pulmonary trunk and the aorta? Well, it's because, as drawn in here in the start of this video, coming from the lungs, we still have deoxygenated blood since baby is not outside the womb and exposed to air. That blood does not have any oxygen. So if that blood comes in through the left atrium and out the left ventricle into the aorta, baby is not going to get any oxygen to the body to grow and develop. So we need to get it from another source. So here I am drawing in deoxygenated blood, which is weird to see that in the left atrium coming through. Deoxygenated blood through the superior vena cava, but now we have oxygenated blood coming from the IVC and into the right atrium. That is weird, but we'll explain where that comes from. That blood can then shunt, it can jump right across into the left atrium and then send it on through the body. Some of that blood does go through the quote unquote normal pathway through the right ventricle and out, but most of that blood drawn thicker here goes through the aorta and into all the vessels. Interestingly, which I tried to draw here, the red and the blue kind of become a darker red. Same thing here, I drew some red and blue that kind of becomes a darker red. Still plenty of oxygen there. But now this largely oxygenated blood can now go through the pulmonary trunk and supply these growing lungs, again, drawn horribly, to give those body parts oxygen. Lastly, through this duct, more of that oxygenated blood can continue on out through the aorta and rest of the baby's body. So that is a neat way to learn and appreciate the difference between adult and fetal circulation through the foramen ovale and the ductus arteriosus. Where is this oxygenated blood coming from? Well, it's coming from the amazing phenomenon that is maternal fetal circulation down here. Pulled this picture off the internet. I know some of these drawings are not great, actually, especially right here, but it displays nicely the foramen ovale and ductus arteriosus. FYI, if you were curious, I do like to play around with AI and the internet and having them create some drawings for me. This is a background that I wanted to have impressionist, abstract, and circulatory system kind of mixed in, and I'll show you the picture later. So I just wanted to have some kind of better background than this boring drab white slide here. All right, here we go. So in this situation, oxygenated blood can go right through that shunt. It's like a flap or fold through the foramen ovale. Deoxygenated blood from baby can come to the placenta, receive that oxygen, and then that oxygenated blood can again go through another shunt, the ductus arteriosus. But what the heck is going on right there? This is drawn a little bit weird, I gotta say. This is a slightly better drawing here. We now have paired umbilical arteries that come down. I drew it blue even though it is not fully deoxygenated because it is coming from the arterial system, mind you. But for the sake of convenience and ease of understanding this, those paired umbilical arteries come down to the placenta, get loaded up with oxygen through the umbilical vein. I know that looks weird. A vein carrying oxygenated blood comes through baby's liver, combines with portal vein, combines with the IVC, and then comes on through into the right atrium, shunts across right there into the left atrium, left ventricle, and out through the aorta. There's also a little shunt right there, not perhaps not drawn well, but that slight pathway makes for additional blood getting out into, for example, the lungs here to fully oxygenate these lungs and let this baby grow. There. This is an example of a colorized version. I actually made it grayscale and then drew it in. I encourage you to do that as well, but this maybe gives you a better appreciation of the different colors. Again, I am horrible with art and drawing. I am trying to appreciate art, which is why I'm drawing and using funny art backgrounds, but you can get a better understanding of how super oxygenated blood, bright red here from the umbilical vein coming from placenta, then starts to darken a little as it mixed with deoxygenated blood from the portal vein and the IVC, and then further gets a little darker as it makes it in through all these shunts. This is a much better drawing that I found that, I mean, blood doesn't actually do this. It just goes right across. It does mix, and this blue and red turn a sort of pinkish color there. But you can appreciate that when blood goes through in shunts, you get well oxygenated blood to partially oxygenated blood, but it is still plenty of blood for a newborn fetus to have to grow and develop. And then when baby comes out of the body, ducts and foramen close. This closes because of a complex pathway involving NSAIDs and prostaglandins that we're not going to get into here. But this closes because suddenly the body has to pump a lot of blood against the systemic circulation. And as the lungs open up, the pulmonary circulation pressures drop. So left side of the heart is much higher pressured than right side of the heart, so the blood can no longer shunt. And it just takes a short amount of time in life as that flap or shunt closes that it just, well, it seals off. There are some pathologic conditions where it doesn't, where you have what's called a patent foramen ovale or a patent ductus arteriosus, and that can be a big problem. But that is not the point of this short video. Here's an example of the grayscale, and you can draw. I encourage you to draw and show me your pictures. I bet you can draw a lot better than I can, but this is the point. You see someone do it, and then you learn to do it yourself, but then you do it better. And this is the backgrounds that I was using for my slides. I kind of like it. It's a little weird, but it's fun to use AI and create some new and interesting creative art. See you in the next video.